Did you have a high-risk pregnancy and your doctor told you you needed to do antenatal testing? Or perhaps they told you you needed to have weekly NSTs, non-stress tests, and BPPs, like weekly ultrasounds? Hey, what's up everybody? Welcome back to my YouTube channel. I am Dr. Allie, I'm an OBGYN, and today we're gonna cover the topics of NSTs and BPPs. I really wanna jump into and explore how these two tests can really tell us information about the well-being of your baby and why we recommend them. If you hear little squeaks in the background, I actually have my baby girl, Eleanor, here on her little bouncer. So in case you hear that in the background, she's here with us. Now, when we talk about NSTs and BPPs, this can also be called antenatal testing. Antenatal just means before birth. So this is something that we do throughout the pregnancy. Now there can be a multitude of reasons as to why we might recommend antenatal testing. I'll kind of explain some of those a little bit later on. Typically NSTs are performed later on in pregnancy in the 3rd trimester because that's when they really give us a lot of information about the well-being of the baby. As an OBGYN, I did end up having a high-risk pregnancy. So I did end up having antenatal testing where I would go into my doctor's office twice a week and we would do an ultrasound one day and an NST another day. We would do a BPP or an ultrasound one day and then an NST another day. So I get it. I've been in that situation. Obviously, I've been the provider and the OBGYN talking to my patients about it, but now I've had the unique experience of actually going through antenatal testing myself as the patient. But for now, let's go ahead and start the video. Let's start off with an NST or a non-stress test. This is a pretty common prenatal test that we use to test and check for the well-being of your baby. This is what's usually referred to as like wearing the bands or the belly bands because it does monitor the heart rate of the baby against uterine contractions if any are present. As I mentioned before, I did qualify to have antenatal testing and I had that qualify for 2 reasons. Let me back up a little bit. So when I first got pregnant, I was 34 years old, but by my estimated due date, which was December 5th, I was already going to be 35. So right now, recommendation states that if you're gonna be over the age of 35 by your due date, we should start antenatal testing at around 36 weeks of pregnancy. I've covered all of this information as to why being over the age of 35 warrants this, and I'll link that video down below on pregnancy over the age of 35. But essentially, when I first got pregnant, I already knew in the back of my mind that we would start antenatal testing at 36 weeks. But to my surprise, we ended up starting antenatal testing at 31 weeks because I had developed what's called oligohydramnios. And this is when babies, this is when babies have low fluid. And in my case, my AFI or my amniotic fluid index was pretty low. And just to be cautious, we started monitoring earlier. And yeah, I started that around 31 weeks. So how exactly does an NST work? During an NST, you have a monitor placed on the mom's abdomen to monitor the baby's heart rate, essentially against its own movements. We also have another monitor on there to track for uterine contractions to see if you're having contractions and how a baby might respond to those contractions. So an expected response in this situation is what's called a fetal heart acceleration or an acceleration of the heartbeat. This could be that the baby's heart rate is just going, and then it kind of jumps up and then comes back down, jumps up again and comes back down. This is normal and a sign of a really healthy, responsive baby. Here's a picture of what an NST would look like, which I would say is a beautiful NST and a beautiful baby. And you can see in this picture those little jumps in the heart rate and then they kind of come back down to its baseline. Completely normal, and that's what we want to see. So why might your doctor be recommending an NST? As I mentioned earlier, there's a ton of reasons why we might recommend an NST. In my case, it was for advanced maternal age or my older age. I say that in quotes because I am still young. Another reason would be low fluid, like oligohydramnios. Maybe your baby is growth restricted, which I ended up having as well. Maybe other maternal condition, high blood pressure, uncontrolled diabetes, you're on a certain type of medication, or maybe your pregnancy went past the due date. These are all indications to do an NST. As I mentioned before, NST provides so much valuable information to us about the well-being of the baby, but it's also giving us information on baby's oxygenization, meaning is the baby getting enough oxygen? It's a great picture of baby's overall health, and it's not invasive and it's easy to do. Now let's talk about the BPP or the biophysical profile or ultrasound. Now a biophysical profile is used in combination with the NST to check the overall well-being of the baby, so it's almost like giving us more information. So the BPP has 5 components: fetal movement, fetal tone, fetal breathing, the amniotic fluid index, and an NST. Each of these components provides such good insight to the development of the baby as well as the baby's health. Now, at the end of a BPP, we do end up with a score out of 10 because each of those 5 components gets a score of 2. In this situation, it's all or nothing. So the score is either 0 or it's 2. During a BPP, you have 30 minutes to find all of these components. The movement, the tone, the breathing, the amniotic fluid index, those are all the ultrasound component. The NST is obviously separate, as we just talked about before. But in a span of 30 minutes, you should be able to see all of this, the movement, the tone, and the breathing. At the end of those 30 minutes, depending on what you observe during the ultrasound, you score. A low score may mean that you need further evaluation and further tests on the pregnancy and the baby, but sometimes a really low score can indicate that you may want to move to delivery pretty quickly, because at that point, you're pretty concerned about the fetal well-being. What I really like about these 2 tests is that they're non-invasive. An ultrasound and an NST are pretty easy to do and to monitor and provide us with so much valuable information. God bless you. I'm just very thankful that I was being monitored closely, and that's why I ended up delivering a whole month early, because it was during one of these routine necessary ultrasounds that we found that my daughter's fluid had dropped from about a 7 to a 1. Yeah, your fluid. Doing these tests made us more aware that something was going on. So it gave us a lot of good information and allowed us to make the decision to deliver early for her well-being so that she could be healthy, and for me too. I started developing preeclampsia, which is part of the reason why all of this was happening. If I wasn't doing those tests weekly, it could have gone missed, and that could have been really terrible, sad news for me and for Nellie. I hope this answered some questions as to why your doctor recommended NST and BPPs and why it is so useful and important. I also really hope that you all are being taken care of by a provider that takes the time to explain these tests, what they mean, and why they're necessary. But if unfortunately you find yourself that you don't have a provider that's spending this time with you, I hope this video helps provide you with more information and give you more peace of mind that these tests are safe and give us such valuable information about your baby's well-being. I hope you guys enjoyed this video and that you find it useful. If you did, share it with someone that you know that's pregnant or maybe has a high-risk pregnancy and you know that they're going to need antenatal testing so that they know more about their pregnancy and feel empowered and informed, because trust me, knowledge is power, and it gives you such a good peace of mind and a sense of control that you know what's going on. Anyway, that's it for today. I will see you in my next video. I love you guys. Take care, and I hope you have an amazing week. Bye.